Kelly.
All right, Jamie, it's Breast Cancer Awareness Month. We're taking your calls and talking about breast cancer. Emily Kachensky, she's a certified genetic counselor with MedStar Health Cancer Network, joining us in the studio. Thank you so much for coming in.
Oh, thanks for having me.
We're talking about genetics and breast cancer, and how many cases of breast cancer are actually caused by genetics?
Actually, so genetic breast cancer is rare. Only about 5 to 10% of breast cancer is inherited. So the majority of time breast cancer happens in families where there's no history of breast cancer. However, even though genetic cancer is rare, it's really important to identify these families because we see cancer a lot earlier in our genetic families, usually before 50, and we also see a lot of more rare cancers like ovarian cancer, male breast cancer, and pancreatic cancer.
I know the baseline is 40 to have that first mammogram, but if there is a family history of breast cancer, I guess obviously it's a good reason to get it done earlier.
So women that have a family history or have that genetic risk factor identified may want to start their mammograms and also a breast MRI at 25. And then some women will consider more aggressive measures. They may elect to have their breasts removed before they get breast cancer, which will reduce their chance of breast cancer by over 90%. And then other women may consider things like chemoprevention, which involves taking a pill for 5 years that blocks hormones and reduces the risk of breast cancer by 50%. So it's scary to have that risk factor, but there are a lot of options that women have to reduce their risk.
What about genetic testing?
So genetic testing, if you're thinking about, is genetic testing right for me, I would strongly recommend that you see a genetic counselor. We are specially trained to take a family history and assess someone's risk for breast and other cancers. And we can also evaluate whether genetic testing is right for that person. This may sound counterintuitive, but we actually like to start genetic testing with someone who's already had cancer because we can see if their cancer was genetic. And so it establishes a baseline for the family. And then from there, if we find something in that affected family member, we can test other family members.
Should you come back for genetic testing?
That's a great question. So yes, due to new technologies, we actually can pick up other genetic risk factors in genes that got undetected with the old technology. So that's one reason. And another reason is that in recent years, we've discovered other genes beside the most common ones that also have been linked to increased breast and other cancer risks. So that's a good question for a genetic counselor to see if you would qualify for expanded genetic testing if you've already had other genetic testing that was normal.
All right, Emily, one of our fine experts taking your calls next door in Studio B. The number to call to get all of your questions answered about breast cancer in this Breast Cancer Awareness Month, 410-481-2222. Don't miss out on this great opportunity to get some of your very important questions answered. Jamie?
All right, Kelly. We all know